All right, so thanks for joining us. We do a daily Facebook update with regards to what we're seeing in Jersey City. We're not going to do this tomorrow, and we'll pick it up again in mid next week because it seems like the updates could be less frequent, and we'll aggregate questions as they come in because the information isn't changing that much on the ground here in Jersey City. The number of cases is as expected. We're currently at about 25 cases. And there is no clusters, and we're waiting on an additional 38 cases from the CDC. We hope that, or we understand that the county is setting up a drive-in testing location in the next couple days. That'll likely be in Secaucus. We're advocating for something in Jersey City as well. They're going to set the rules around that, and they're working with the state. And then the most frequent questions for us are around some basic policies on the parks, on construction sites, on faith-based organizations and religious groups and churches and mosques and synagogues. And Stacy could speak to that. I'll turn it over to Director Jim Shea, who's the Director of Public Safety, to talk a little bit more about some of the things we're seeing on the ground.
Okay, I would just like to say quick update, same as we've been saying all along, all of our police and fire are operational, all of our units, there is no increase in response time, anyone who calls for help gets it. So we're happy about that. Parking, again, we are only enforcing no hydrant, corners and crosswalks, and blocking someone's driveway which affects their ability to get out. The corners and crosswalks are important to us because emergency vehicles need extra space to turn into our small streets. So thank you to everyone who's been cooperating with us, but be advised we are still issuing summonses for those 3 offenses. Any other problems, you can reach out to us at parking. And emergency management has succeeded in starting to obtain the supplies we need. I want to give a thank you to them. I'll just end this week by saying thank you to all the citizens who are cooperating with our police and our fire as we get through this together. We know how inconvenient these restrictions are for everybody, and we are working to get to where we don't need them as soon as possible. Everyone is pulling together, so thank you on behalf of the police and fire who are out there. Thank you to all of you. Stacy?
So as I've mentioned several times, we are focused on our most vulnerable. So we've closed the WIC clinic today. We're transitioning all of the senior lunch programs into Meals on Wheels programming, and starting next week we'll start taking additional names of seniors that are in need so that we can prepare them to get them onto the Meals on Wheels program. Also next week we'll start to provide more in-home activities and information on JC Responds, so that's on the website for the city. In addition to that, we have just, thanks to the Office of Emergency Management, have gotten a bunch of cleaning kits. Priority is going to go to homeless shelters and then our senior living facilities. And we're working with the Division of Community Development to create that list so that we can provide additional cleaning materials for the weekend and support our city's most vulnerable. Around the parks, we closed the parks because we were noticing that there's a lot of people congregating, and social distancing is really a key way to flatten the curve. We've noticed that this is how it's working in all other countries, and we really appreciate some support in that. We understand people need to go out, but we're already seeing with the parks closed, people entering the parks. So we're just asking, it might be a really great weekend to just be really aware of the people around you, if you can avoid others, and social distance yourself so that you can protect yourself and your family.
Last night we had a conference call with about 100 pastors and religious leaders from Jersey City, walking through with them directionally where we think we're going. We're not adding any additional restrictions or requirements, but we can certainly see in the next few weeks this going in that direction statewide. And we were urging them to start focusing a little bit more on online services, streaming services, video services, and we're going to partner to help them with technology around that. We certainly recognize that they provide vital services in the community, specifically around food pantries and seniors, so we're reluctant to shut people down, but we do want to work cooperatively on that front. We had a meeting today in a press conference with Christ Hospital around what they're changing on protocols. Jersey City's ahead of the curve on that as well. Most specifically with regards to how they're going to access and check in people into the hospital to make sure that they are putting people into the proper queues in the case that things increase. We do get a lot of questions around ventilators and equipments and beds. They did offer that very clearly, so I'll communicate what they said. They said they have 20 ventilators on hand. They have access to 20 more, and they're repurposing the emergency parts of the emergency rooms and surgical rooms for extra beds if need be. And they are no longer doing elective surgery, and they are repositioning the hospital in order to deal with an increase of patients coming in. So from a Jersey City standpoint, I think we continue to be at the forefront of policies. We're thinking proactively, and we'll update you again next week as we have more additional information. And thanks for bearing with us. We know it's not easy, but it's really going to take a community team effort to get through this.